This is a special edition report highlighting the deepening summer crisis in Danish home care services. Home care in summer crisis. Elderly risk going without baths. For weeks last year, Denmark's largest summer house municipality was brought to its knees. And once again this year, the home care system is under severe pressure. Each summer, thousands of Danes flock to the country's popular holiday destinations in search of peace and relaxation. But in many of the largest summer house municipalities, the influx of extra guests puts immense pressure on local home and nursing care services because the demand for home care travels with people when they move temporarily into their summer houses. That pressure is certainly felt in Odsherred, which, with around 24,000 summer houses, is Denmark's top summer house municipality. We send out a summer letter to our citizens to prepare them for a period of changes in planning. Maria Liv Holk, independent, chair of the Social, Elderly and Psychiatry Committee in Odsherred Municipality. I'm worried about what kind of summer lies ahead. Rasmus Gurmsen Hansen, head of care and health, Odsherred Municipality. Last summer the system collapsed. Home care workers were overwhelmed by the number of holiday guests who were entitled to services, while permanent staff were on their own summer breaks. Some elderly citizens went weeks without a bath. Evening meals were served far too late. In some cases, elderly individuals were denied help putting on or removing compression stockings, despite being approved for that service. Sjællandske Nyheder reported such incidents, calling it a crisis where home care collapsed, staff were crying, and citizens were abandoned. Our consciences can't take it anymore. The summer has become a nightmare for home care in Odsherred. Our consciences can't take it anymore, and our bodies are close to giving out. Enough is enough, writes a home care worker. Between 5 and 10 staff are missing daily, and there's no help in sight. Many care visits, like help with hygiene, bathing, compression stockings, dishwashing, are being canceled. In a letter sent by 5 union and health representatives to local politicians and management, they paint a grim picture. Citizens going weeks without bathing, fungal infections and untreated wounds, missed medication doses, staff breaking down in tears due to stress, family life sacrificed for overtime and emergency shifts, daily shortages in staff, burnout, and rising sick leave. The letter, dated July 23rd, came from South District staff, but the same crisis persists in the North and Central districts. As recently as Friday, 30% of staff were absent in the central area. Despite earlier reassurances from Care Director Rasmus Gurmsen Hansen that essential services like food, medicine, and toilet visits would always be prioritized, there has been no real improvement. Staff now say frustration, helplessness, and anxiety have taken over, especially among mentally vulnerable citizens who rely on structure and trust. Use of emergency call buttons is increasing, as are angry calls from family members. This is only getting worse. Committee Chair Maria Liv Holk admits the letter reflects the true depth of the crisis and that she has no quick fix. We're still missing permanent staff, and it's hard to find temps. Sick leave is only making it worse, she says. Her proposal: direct more patients to nursing clinics to ease the pressure on mobile home care staff. But she admits the administration has failed to implement this fully. Many nurses aren't properly informed about the clinics, so they don't refer citizens as needed. There's a breakdown in communication, she adds. She also blames poor summer scheduling and says this must be evaluated later. But she stresses one key point: 30% sick leave is unacceptable. That's extreme, Holk says. When asked what to do if people are genuinely sick, if you're sick, you're sick. But if it's about working conditions, then you have to take responsibility. Talk to your team leader and find solutions, she says. No quick fix. Can the situation be fixed with so few hands on deck? If we can shift tasks, move them to clinics, then yes, Holk says. But this has no quick fix. This will only get worse. A quarter of our care staff will retire within 5 years. We need to restructure and rethink the entire system. That will affect service levels. Can she guarantee next summer will be better? I wish I could promise that, but I can't. Widespread staff shortages. According to Rasmus Gurmsen Hansen, this year is no different. We're struggling with staffing. We don't have enough hands to cover all shifts, he says. Despite odd-shared municipalities' efforts, including outsourcing to private firms and asking staff to take extra shifts, there are still huge gaps. Top 10 municipalities with most summer houses 2024. Odd-shared: 24, 200 Gribskov 14, 800 Ringkobing, Skjern 10, 500 Sidjurs 10, 400 Jammerbugt 8, 800 Halsnæs 8, 700 Kalundborg 8, 500 Varde 8, 500 Goldborgsund 7, 700 Frederiksund 6,200. Source: Statistics Denmark, rounded figures. Other municipalities feel the heat to Gribskov and Ringkobing. Skjern municipalities also report similar pressure. "We don't have red alarms yet, but the pressure is real," says Lotte Boserup, head of home and nursing care in Ringkobing Skjern. "There's no doubt this is a major challenge," adds Hella Lund, chair of Elder, Social and Health Committee in Gribskov. In Odsherred, the municipality was already short 350 shifts by mid-June, an average of 5-6 per day across summer's 9 weeks. Citizens were informed through summer letters that in weeks 26-34, there would be changes to care delivery. Basic needs like meals, medicine, and toilet visits would be prioritized. But services like cleaning, hair care, and shaving might be delayed or skipped. Greta, 89, and others affected care assistant Louise Zachariasen races through her visits. At her next stop, Greta Fager, 89, needs immediate help to the toilet. Greta is thankful it's Louise, someone she knows, but not all visits are so familiar. "In summer, it's often someone I don't understand who doesn't know what to do," Greta says. Louise has already noticed more summer house guests on her route. "So we cancel baths. They must go to the toilet. They need food, but something has to go. It hurts my heart to know a citizen hasn't had a bath in 3 weeks," she adds. Hanna's mother, 3 weeks without a bath. Hanna, Rano. Fjellstad's 74-year-old mother, on oxygen and with only 21% lung function, receives home care 3 times daily. Last summer, due to the influx of summer guests and lack of substitutes, her mother didn't get a bath for 3 weeks. Every time someone new came who didn't know what to do, Hanna says. Her mother, now waiting for a nursing home spot, relies on that help and the social contact it brings. She's lonely. "I live 100 kilometers away and visit every 3 weeks. But she needs that daily human connection," Hanna explains. Recently, staff called to ask if they could skip the midday visit. Her mother agreed. But she then missed lunch. She couldn't get it herself due to lack of breath. "My mom doesn't want to complain about the helpers. She knows they're doing their best, but it's not a dignified way to grow old." Oversight of nursing homes in Denmark. At a glance, municipalities, kommuner, operate nursing homes and deliver elderly care services, provide home care, personal care, and daily assistance, implement national standards. Locally, Ministry of Health State sets legislation, frameworks, and quality standards, oversees national health policy and funding regions, handle hospitals and specialized healthcare, support medical care in nursing homes and discharge coordination. Danish Patient Safety Authority, DPSA, monitors healthcare safety in nursing homes, investigates complaints and enforces corrective action. Danish Health Authority, Sundhedsstyrelsen, provides public health guidance, prevention, and rehab support. Issues. Clinical guidelines for elderly care. Summary. Municipalities, direct service providers. State, rule setting and oversight regions. Specialized care support, DPSA, safety and supervision, Danish Health Authority, prevention and professional guidance. In conclusion, Denmark's nursing home system relies on a well-defined collaboration between municipalities, the state, regions, and health authorities. Each plays a vital role to ensure quality, safety, and compassionate care for the elderly. This coordinated approach strives to meet the complex needs of seniors while maintaining high standards across the country. Danish-InfoNews TV, thank you for following this special edition. Stay tuned as we continue to monitor the evolving situation in Denmark's home care sector. Until next time, take care of each other.